Hi there, and welcome to the Institute for Natural Medicine's podcast, The MD Will See You Now. In this podcast, we talk to naturopathic doctors all across North America to find out a little bit more about their whole person approach to health, what patients can expect, and why their work is so very vital to patient health. I'm your host, Annalisa, and today I am just absolutely delighted to have Dr. Baljit Khamba with us, naturopathic Dr. Baljit Khamba. So Dr. Khamba, you are based in San Diego, California, but you do hail from the Great North, from the Greater Toronto area in Canada, as do I. And you are actually you actually teach for Bastyr University. You're the chair of clinical sciences, and you're a researcher, consultant, and speaker on a variety of natural health issues. But that is not the end of your story, because you are also a proud breast cancer survivor and thriver. So for all those reasons and more, we're so delighted to have you here today. Thanks so much for joining us, Dr. Khamba.
Thank you so much for having me here today. I'm really excited to be able to participate.
Well, let me start by taking you back a couple of years from now to 2019. If there's any Golden Girls fans in the house, I'm really going to be channeling Sophia right now and saying, picture it. It's 2019. And at that time for you, well, life was pretty good. You were about 40 years old. You were about a decade or so into a pretty successful naturopathic practice as a naturopathic doctor. And just at the time, you and your husband were negotiating. You were in Canada. You were going to teach at Bastyr. So he's in Toronto or in Canada here. You're in San Diego, all of the visas, all of the things you're negotiating. And then in the midst of this, bam, cancer diagnosis. In just that instant, you suddenly find yourself on the other side of the table, so to speak, as a patient. You're thrown into this world of cancer care and associated fertility issues, might I add. And you tell this story really well on your website. So listeners, I strongly encourage you, please go to Dr. Khamba's website, which is foodandmood.co. And she really details in a very authentic, honest, and open fashion what that journey was like from the moment I mentioned when you got that diagnosis to, of course, a little closer to where you are today, being a cancer survivor and thriver. And as I mentioned, not only are you an ND that's going through this patient journey, but you're also a South Asian woman. And we know that sometimes healthcare can look a little bit different for us in terms of health equity issues. So I wonder if I can take you back to that time, Dr. Khamba. Can you tell us a little bit about that cancer journey, and specifically with an eye towards what did surprise you as an ND going through the cancer care system as a patient and as a South Asian woman? What health equity issues were you coming up against?
It was a very, I'll never forget 2019. That was obviously a huge part of my life. And actually, we're just about 2 days shy of my 3-year anniversary of having been diagnosed. Yes, I remember it was, so we're just a couple days shy of that, 2 days shy of my cancerversary. And so what happened was, when, as you mentioned, we were back and forth. My husband's from Northern Ireland, so he wasn't able to get settled right away in the US, so he was still in Canada. And so all that back and forth was going on. And we reached a point after 2 years of doing that where we sat down and said, I think we need to go back to Canada and regroup and kind of figure things out to see what's going to happen. So at that same time, I said, you know what, actually, I found a lump in my breast. And, it's not the same sort of cyst type of lump or anything that I was, that I originally thought it might be. I think this might be a little something more sinister. I'm not sure, but, I definitely know I want to get it checked. So, and we were here in San Diego at the time. So then my husband said, okay, let's just, today, let's just go over to urgent care and see, our urgent care in San Diego and see if we can at least get some imaging done. Because we weren't set then to head back for another, I think it was like 2 months. So then I tried to get some imaging. We went to the clinic there, and, the costs to get it done, I really had a good understanding at that moment of the divide between US and Canadian healthcare, where in Canada, we take it for granted how wonderful it is that we all have access to care, that we don't have to think about it. But here in the US, your health is really a statement of what finances you have accessible to you. So at that time, I didn't have health insurance. And so when I tried to pay to get an ultrasound done, it cost such a huge amount that I said, do you know what? I'm going back to Canada in another couple months. I'll just wait until we go down there, knowing that, I thought it might be something small. I wasn't entirely convinced yet either. Then we head back to Canada. And when I came back to Toronto, it was great to be around, I was diagnosed really quickly. I was thankful. I was with Trillium, and they at that Credit Valley Hospital, and they diagnosed me really quickly. And I was thankful for the care, and I was appreciative of it. But I have to say, when I started, and because I was at 40, I had cancer. They discovered that I had 3 tumors, and they were quite large. And because I'm younger as well at the time for cancer, they thought, let's try to reduce the tumor size first before doing surgery. Normally you have that the other way around. But usually you get surgery first and then you follow it up with chemotherapy. But in my case, they wanted to try to do chemo first. So I did chemotherapy first. And it was interesting because when I would go there for my appointments for my chemotherapy, and it was weekly or by every other week, I would go in, and the volunteers or the people who are checking you in, they would say to me, they're like, well, you're too young to be here. I was like, don't I know it? So that was one part. But I was also appreciative, the great thing, especially, and I noticed this difference from, being in San Diego versus being in the GTA, was that when I went to go see my doctors, for the most part, the doctors that I did see looked like me. So, a lot of them were South Asian, which was great. The ones who weren't, I have to say, I did notice with them that, the understanding of how to care for me was a little different because, when I go to appointments, I'd have my mom with me, my husband's with me, like people are all around me. And when I was getting care, my family's all around. It's just how it goes, and from a cultural standpoint, we're very collectivist. And so when it comes to the food and when it comes to the care, sometimes the doctors, and this was just pre-COVID as well. And so at that time, the doctors were saying, it's, the food that they were stating, they're like, oh, you're probably best to eat. At that time, they're saying, eat whatever you want, have, whatever junk food you want, just get food into you. Don't eat spicy, don't eat this, don't eat that. There was a few stipulations, but I was like, some of those foods actually, I think, coming from as a naturopathic doctor, it's like some of the foods I would actually promote a bit more. And also I was like taking my cultural heritage into consideration. You're making some claims around there as well that, might not entirely hold up from a food perspective. So it was interesting because, right away, the assumption was from, my non-South Asian doctor, he looked at me, he's like, well, you're going to have to cut out all those spicy Indian foods. I'm like, incorrect, sir. We don't all eat spicy foods, and and I was like, spices mean, all the different spices that we had, not just the cayenne pepper. So, hearing comments like that, thankfully they were far and few between, but, I was fortunate that, I was able to go back home to Canada, be in my home, be around loved ones, and get the care that I needed. Whereas here, that was obviously not going to be something I could do. So I was thankful for that. I was also appreciative looking at things, from that Canada-US lens, because after my treatments and after surgery and everything was done, my first bit of surgery was done in Canada, and then we came back to the US after my husband became a Canadian citizen and was able to secure work pretty easily again in the US. And I was able to go back I went from being full-time, then when I took my break, I became an adjunct, and then I came back again full-time. So I didn't leave Bastyr completely. And so when I came back, I was able to get back, he was able to get back, and my care continued in the US. So now my care was US based. And that was different because I saw for the first time, now I had health insurance too. And I came armed with health insurance, and it was a really big discrepancy again that I was able to see first, using my public health background, noting the differences that I see from Canadian healthcare, which was good healthcare for everybody. But then in the US, if you have health insurance and a good health insurance plan, which fortunately I did, you get some luxury care, which on the one hand, I was thankful for. On the other hand, I am completely aware that this healthcare that I'm receiving isn't accessible to everybody, which was a difficult sort of thing to go through as I was, getting my own care. And so, it was definitely, it was interesting to kind of see those crossroads. And then as well within the US here, whereas in the GTA, like I said, a lot of my doctors look like me, which was great. In the US, that wasn't always the case. I had one doctor, one of my, oncology doctors was South Asian, where the others weren't. And so from there, it was interesting because when they had to do my surgery, there are different factors when it comes to play with a smaller, South Asian woman who's athletic as well. And so when it comes to surgery, I had long 12-hour surgeries, and that also caused discrepancies because I was younger than perhaps most people that they've done the similar types of surgery when it comes to all of my, reconstruction and preventative and all that sort of stuff. And then further, being South Asian, my metabolism in the way that I process certain medications might be different too. So, and so that was new to them as well, to some of the residents and interns who were working with me at UCSD. So, I mean, overall, fantastic care, but, it just came through, some of the differences in learning about, one, access to care, and secondly, understanding of cultural heritage when it comes to different places.
Well, that's a lot of learning, and not just even on the being on the other side of the table aspect as a patient, but as you pointed out, there are some significant differences between the healthcare systems in Canada and the US. And it's not just a difference on paper. I think your experience really speaks to what those differences look like, not only in terms of the financial accessibility aspect, but also in terms of the appreciation of cultural heritage from several things that you mentioned. And I can't help but think that after going through this experience for yourself, that when it came time for you to resume seeing your own patients, I can only imagine that all of these learnings and lessons and experiences you had must have been quite front of mind. So how did that look when you did get to that point when, majority of cancer treatments and whatnot are wrapping up, at least to the extent that you can start practicing again on a full-time basis and get into that? What was it that you found actually changed in terms of how you're delivering care? Naturopathic care to patients. This could be cancer patients. This could be any of your patients. What were you finding? How did things change?
So I'll backtrack a little bit. So when I got to sit in the patient chair for now, as I was going through my cancer treatments, I got firsthand experience on what it's like to, fully need access to care. Whereas, I was healthy before, nothing more than say like a wisdom tooth removal, the odd imaging here and there, nothing that was really exciting. So, I was pretty boring. I didn't utilize the healthcare system very much. And for my own health, I had to, I was fairly capable of managing my own care. However, when I got sick, it was the first time that I placed my trust in not just my oncology team from a conventional standpoint, but I also had my yoga practitioners, my acupuncturists, my own naturopathic doctors, and nutritionists and everyone on board. And so I got to be the patient, where that was a great experience for me, because I wouldn't have known, not that I wouldn't have known, but I wouldn't have, I think, appreciated it, and being able to work out all the fine details. Because when you're on chemotherapy, there are certain things that you can and can't be on, and certain things that, as far as botanicals and nutrients and supplements are concerned, there's certain things you can and can't be on. And I was on 2 different chemotherapy medications at 2 different times. So there were certain ones I could take with one, certain ones I could take with the other, and, different areas that we wanted to work and support the chemotherapy that I was going through, and as well as to try to prevent some of the side effects of the chemotherapy so that it became tolerable. And so I put my trust in naturopathic medicine, so that I could, in my colleagues, so that they could treat me. And so that, in my state of fogginess, I didn't have to focus on what am I taking, what am I doing? Instead, I had a plan laid out for me, which was great. And I'm so appreciative. And this is something that goes back to just being, having gone through the program of naturopathic medicine. we were a group of our cohort, we all went through everything together. We've gone through lots of ups and downs as a cohort. And so now, when any of us need anyone, it's wonderful that we're there for each other in an instant. Even if we haven't seen each other in years, they're still, right away, they're there for you. They were there for me. I got, everything from phone calls and well wishes to tinctures being delivered to my house, things that brought me to tears. So I was appreciative. Now, when I was back here in San Diego and starting to see my own patients, I really found a shift, not just in my patients, but in the way that I was teaching as well. I noticed a key difference in those two areas. And I also trigger that to the fact that while I was going through chemotherapy, I before I actually came to San Diego, I was doing my PhD, and then I stopped my PhD and I came to San Diego. And then I discontinued the PhD. I was like, well, I'm already here being a professor now. I'm good. And then when I was going through in the midst of chemo and I didn't know what lay ahead for me, I said to myself, I was like, I've got it. I started a doctorate. I have to finish it, but I want to change what I want to do. This time, instead of I was doing a PhD in medicine, I changed it to a doctorate of education because I really wanted to change the face of education from a health standpoint. And secondly, I wanted to be a leader as a South Asian woman. I wanted to be a leader in that space. And then also I wanted to change the way that I practiced. And I was a clinician as well. So then when I went back and I was strong enough again, I started a new doctorate program, and I've got about a year left now. And then in addition to that, my teaching with the education that I got I was getting educated through this doctorate of education program, my teaching and my clinical changed in the fact that not only was the format changing in where I'm now more inquisitive and trying to listen more and hear more from my students and from my patients, but I also have a different eye towards my patients, where there's that eye of compassion and understanding when you've gone through something, whether it's cancer or something like a long journey of suffering. You can really appreciate the suffering of others, whether it's fibromyalgia, IBS, or cancer, or anything else. I really learned, whereas I appreciated things before and I felt for my patients, now I have a deep understanding and a connection with my patients that I didn't realize I have before. And that connection goes the same to my students, where I have that connection. And, I had compassion before, but now I have a deeper sense of compassion where, I truly value each person and value what they're going through, and really try to make efforts to understand life from their perspective. I think it's quick for one to assume what someone is going through, but another to be asked, how are you doing with what's going on? And really listen. Like I'm sure I asked these questions before to my patients. I liked the way I practiced before, but now I feel like I truly not just listen, but I take it in. It's like it's in here now. So and that changed the way that I then treat my patients, because I'm taking it from that value of what they're saying, of how they're doing, of where they're at, of what their journey has been, and where they would like to go. And so from this, my previous work was focused largely on nutrition and mental health, and it still is. But now I'm seeing more and more patients going through cancer because they've, heard my story, or fertility, or hormones, a lot of that sort of stuff as well. Because as you read in my blogs in the beginning, we were given 2 weeks to say, we've got to start chemotherapy. We can stall for maybe 2 weeks, but you've got to do chemotherapy right away. Go do whatever fertility preservation you can do. And so in that process, we were able to save one embryo, and it was it was like a 7-day embryo, or day 7 embryo. So it didn't, hold the highest chance, but we gave it all the hope. And that was the direction of my treatment, was to get to that endpoint of having that embryo. And then, recently when I was finally deemed healthy enough to transfer that embryo, it failed, unfortunately. So, so again, I was back in that chair again, now, not just going through cancer treatment and succeeding in that, but now understanding, because I had the last 3 years has been all, between surgery and fertility work. And so I've had these 3 years of, fertility and failure. And so, and seeing what that means to me now. So now going through both of these journeys and seeing, now, I've got to start blogging about this because I haven't really had that gone through that process. But knowing about that, people have been reaching out to me for that. And again, I've developed such a deep appreciation for people who are struggling when it comes to fertility and when it comes to their to what a family looks like for them, and really reinventing what families look like. So, and before I get off on a tangent, I'll stop there.
Well, it's an important issue. I really appreciate that you mentioned not only how your naturopathic doctor role, as in delivering care to patients, changed, but I'm really glad you brought the education side of things into it, not only in terms of your own continued studies, but in terms of how your experiences were also, changing how you saw the educational experience as well, what your, with your teacher hat on, so to speak. So there's a lot in there. And fertility, I think a lot of the times people don't realize that if there's a cancer issue, it's not just a cancer issue. There may be a number of other conditions, either pre-existing or not, that are impacted, or in your case, something that was maybe going to be on the horizon in the near future. And on one hand, although I am not very happy about the fact that it didn't take with the embryo, I am delighted by the fact that they did deem you healthy enough to go through that step. And we just have a couple minutes left, but I do want to touch upon the food aspect. So when one looks at your website, one will see clearly stated that a healthy mind starts with healthy foods. And we know that you also do come to the naturopathic profession with quite a bit of mental health experience. You have a degree in psychology. You've done mental health research. You've worked at integrative psychiatric clinics. So what I'm wondering is, what does this look like for patients? How are you actually integrating this food as medicine approach into your naturopathic approach, and what might that look like?
Sure. As being a naturopathic doctor, we use a multitude of things to help care for a patient, but always with the idea of, getting down to the root cause of what could be going on for that patient. So when looking at that, I consider food to be foundational. Food has got so many, it's not just nutrients that we provide our body, but it's also how we feel. It's also, the community around us as we're consuming. It's got memories tied to it, smells tied to it, so many different things. So naturally, we want to look at the mental wellness component of it. So I take a look at it from a couple different perspectives. One, I like to see what my patients are eating. One of the first questions I ask you after patients giving me sort of their history and what they're in for, I'm like, what are you eating? What's your diet like? What foods are you normally consuming? Because from a cultural standpoint, I want to understand what their food and intake looks like, so that when I prescribe food, I'm trying to prescribe to their culture as well. So I had tons of books on, I remember when I was working in the integrative clinic, so the START clinic for mood and anxiety disorders in Toronto, I had quite a few patients from the West Indies, and they would give me cookbooks, because as we were working through their food, I would want to make sure that I was remaining within their culture as well. And so we would go through the cookbooks and really pay attention to that. Now, what I'm looking for from a cultural standpoint is that when we look at our modern foods that we're consuming in today's age, especially the fast foods, a lot of them are energy dense, because that's what they need, is a ton of energy. But because they've been so processed, they're nutrient poor. And our brain is the most metabolically active organ in the body, which means that it requires the most energy, and it requires most energy because it's the one that's doing the most work. So if we're giving our body this processed food, which has tons of energy, but no nutrients, and our brain fuel is nutrients, well, we haven't done much but increased our waistline and starved our brain. And so what I'll focus on then is looking back and seeing how we can provide some nutrient-dense food for our patients, one. The second thing I'm trying to do is, because there's also this gut-brain connection that we got to work on, so making sure when we talk about that, the good bacteria that resides in our gut is also helpful in creating those things for our brain. Now, when we talk about our brain, we talk about everything from focus and attention for our ADD, ADHD patients. It could be even like our ASD So our Asperger's, autistic, could be anybody with like learning issues, or even things like stress, focus issues, depression, anxiety, bipolar, all those gamut of things. What we're looking at is how we can provide key nutrients that will help feed the brain, help increase that gut-brain connection. And not just gut-brain, it's also, liver-brain connection, it's the skin, like everything. But those are some key areas that you'll hear me talking about. And like I said, with keeping a keen eye to what happens in your daily diet, so that I can make modifications that are within realm of reason, rather than, if I go to, say a Taiwanese woman, and give her, a background of the Mediterranean diet where she's like, well, I don't know any of these foods. This isn't what I eat. At least I can provide something that's, I can go based off of her diet and see where we can make improvements and change things.
Those are some excellent examples. And just thinking about everything that you've spoken about today, you've really given us a sense of the importance of empathy and the importance of not only asking the right questions, but of actually listening to the answer, and really taking that on. And when it comes to the cultural considerations, it sounds like some cookbooks might be coming into play, and you might be learning some new recipes as well, maybe from your patients. So I think food is just, it's the ultimate leveler, right? I mean, we all are in maybe from different cultures, different financial circumstances, but to talk about food, with a patient, just that being the great leveler is such an empathetic thing. Well, that's about all we have time for today, because we could go on for some time talking about all of these very important issues. But thanks so much for joining us. You shared your journey from cancer survivor to thriver. You've talked quite a bit about really how it's impacted the way that you're delivering naturopathic care to patients, also how it's changed the educational side of how you're dealing with naturopathic students that are the next generation, so to speak, of naturopathic doctors coming up in the world. And you've made a pretty darn good case for how food can really be our medicine. And as you mentioned, the brain being that very, really part of the body that is requiring those dense nutrients that sadly, as you pointed out, we're not seeing in those foods. And when we do give our brain what it's truly craving, then we're going to see, some improvements in mood and really in overall health. So for listeners, if you're looking for a transcript of this interview, and if you'd like to learn some more about Dr. Khamba's work, please do check out the podcast notes. And all that's left to do is thank all of you for joining us. And Dr. Khamba, thanks again. It's truly been a pleasure.
Thanks for having me.